Today I'm going to show you how to inject a GLP-1 medication. The example medication in this video is Mounjaro, however the same method applies to all GLP-1 injections prescribed by us. Firstly, you must wash your hands thoroughly using soap. Remove the sealed needle from its sterile case by peeling back the lid and screwing onto the top of your medication, ensuring it is securely screwed into place. You can then remove the plastic casing on the outer part of the needle top. If this is the first use of the pen prescribed, you will need to prime the injection pen. Simply do this by clicking the dose button 2 clicks until you see it on the first long line in the dose window. Point the needle towards the ceiling, and you can always tap the cartridge a few times on a hard surface to help move any bubbles to the top. Click the dose button until it returns to 0, and then slowly count to 5. Your pen is now primed and ready for use. Using the sterile wipes provided, sterilize the area of your skin you are injecting. This tends to be most comfortable in the tummy area, 2 inches from the belly button, or you can inject in the upper thigh. You can also inject in the back of the arm, although someone else will need to do that for you. Prepare your dosage by screwing the dose button until there is a 1 in the dosage window. Pinch the area to be injected and insert the very small needle into the injection site. Administer your dosage by holding down the dose button until it goes back to 0. This tends to be easier using your thumb to push the dose button rather than a finger. Once the dose window displays a 0, count to 5 slowly, then carefully remove the needle. Your medication has now been administered, and you can dispose of the needle into a sharp bin.